Welcome to Technology Excellence Conclave 2024 organized by Business Connect magazine. This is Kajal Rubhal, your host for today. And as you can see, I'm sitting with my distinguished guest, Mr. Indranil Roy Choudhury. He is the CEO and Director of Apex Kidney Care Private Limited. So thank you so much for joining us today, Mr. Choudhury.
Thank you so much.
Pleasure is all ours. So let's get started with talking about the company profile and services. Not just, we won't say it's a company, we would say that it's an institution which is working for the welfare of people out there. So would you walk us through your services so far?
Okay, thank you, Kajal. Kajal, we provide dialysis to critically ill kidney failure patients. We need to understand that kidney failure is a very big problem in our country because the main reasons are diabetes and hypertension. And when a patient has a kidney failure, there are only few options the patient is.
Great. Okay, great. So you are the CEO, and we would say that you are just steering the wheels of the success of the institution. So can you just walk us through the impact it has generated in people's lives so far in the overall healthcare sector? You can share the facts and figures, the lives you have changed so far, and how many people are connected to you.
Okay, so being an organization founded and promoted by a group of nephrologists from the city of Mumbai, we as Apex Kidney Care has always been focused on the quality of dialysis that we provide and how we can make an impact in the patient's life. So for us, always quality has been of the prime importance. Now to monitor quality, what we have done is long back when even the healthcare industry was not thinking of electronic medical record, which people talk about today, we as Apex Kidney Care in collaboration with IIT Bombay developed something called as Axis EMR, which is a specific renal data management system. And in this we track that dialysis outcome of every patient. You will be very happy to know that we are soon going to publish our data which talks about the survival benefits. And that's the ultimate thing about the quality of dialysis, how we are improving the survival of the patients. So that's an impact we bring about for the patients. Regarding the impact on the environment, dialysis is a process which requires large volume of water. So to address that, we have taken two steps. One, the reverse osmosis plants that we use are offline, which ensures that it delivers the requisite quality of water without any wastages, and hence we use much lesser water. The second point we want to make is, in the dialysis centers that we own and operate, we ensure that the rejected water from the reverse osmosis plants is being cycled back for reuse. Also, dialysis requires a dialyzer, which is an artificial kidney, which is not manufactured in our country, or even if it is manufactured in very less quantity. So it is primarily imported from the other countries. Now, whenever you use a single-use dialyzer, it has a lot of carbon emission, which has a serious impact on the environment. So from the dialysis that we do, almost 65% of our dialysis that we do, we use a reused dialyzer. Now, scientifically, this is proven, medically, this is accepted, and also endorsed by the various international societies. So when we do that, we actually bring down the carbon emission to 1/8 or 1/10 of the original one. So that is how we make an impact on the society, on the environment. For an impact on the society, when we launched this organization Apex Kidney Care, we realized that one of the major challenge to run a successful dialysis program of global quality in this country is the requirement of manpower, because the country does not have adequately staffed and adequately trained manpower. So in collaboration with Tata Institute of Social Sciences, we formed something called as Apex School of Dialysis Technology, where we train dialysis technicians on the requisite quality, and so far we have trained nearly 2,000 technicians. Recently, Maharashtra State Board of Vocational Education has also granted us permission to run both degree and diploma course.
So your social consciousness and as well as your CSR activities are truly commendable, and we wish you all the best for that, for your brighter future. Also, Mr. Choudhury, I would like you to shine some light on you being a CEO. What would be your leadership mantra? What it is that drives your success, and how do you motivate the budding entrepreneurs out there?
See, being in healthcare, I would share two things. First of all, there's no shortcut to success. That's the eternal saying. The second one is we have to be cognizant of the fact that we being in healthcare, the leaders in healthcare industry have to be cognizant of the fact that we save lives of people. So quality has to be of utmost importance. So how we ensure quality, and mind you, quality is the right of every citizen. So how we ensure quality is the that's the responsibility of each and every healthcare leader, and it cannot be compromised under any cost. While the other principles of management remain same, I think these 2 points, that quality as well as there's no shortcut to success, are the two main things. The other one I like to highlight is automation. The whole world is talking about automation, and there are plenty of automation coming into healthcare, and this can really transform the healthcare landscape of our country. Thanks.
So you mentioned about automation as well, yeah, which is the theme. Basically, we would say that technology is the theme of our conclave. So, would you like to elaborate on that? Like, what could be the possible, tech disruption, we would say, that would be taking place in your niche? Because the kidney care is we would say, the niche. The focus is on dialysis and kidney care. So, would you like to share a brief on like what it is that could be changed in the next 10 to 20 years?
So, Kajal, what is going to change in the next 10 to 20 years? Before going on to that, I would like to share two used cases of how we have used automation to make an impact in the society. We as Apex Kidney Care incidentally run nearly 65 dialysis centers in the state of Madhya Pradesh under the private-public partnership program. When we took up this project, we realized that each and every patient was traveling on an average 51 kilometers each day, one way, to avail dialysis. Now, this is significant because it means that the patients will come for lesser sessions, they will get inadequately dialyzed, and ultimately it will impact their health. Now, because of the Access EMR software I spoke about, where we track the data of each and every patient, we geotagged these patients in our software, and we saw that the nearest center that is available from the government, where we provide dialysis free to these patients, and then we used our helpline to divert these patients from a near to their nearest centers, so that their average distance traveled comes lesser. And when we were able to do that, we saw that the average distance traveled by the patient, which was earlier 51 kilometers, came down to 31 kilometers, and this made a huge impact in the patient's quality of life. So that's one use case. The second one which I would like to highlight is a learning for all of us, that if the government and the private decide to join hands, there's nothing impossible in this country. So during the COVID pandemic, Mumbai city has got about 10,000 dialysis patients. And dialysis is such a thing that every patient needs to take 3 times a week, and missing a session can be fatal. So during COVID, they were not sure who was COVID positive, who is a COVID suspect, and who is COVID negative. So many of the patients were actually missing the dialysis sessions. So we joined hands with Mumbai Nephrology Group, IIT Bombay, and the BMC, Bombay Municipal Corporation, and we set up something called as Project Victory. Within 48 hours, a portal was created which would divert patients to the dialysis centers which were classified as COVID positive, COVID suspect, and COVID negative. The result of that was not a single patient lost their life after this was launched. This was such a successful project that the Indian Journal of Nephrology published this report, and this is a significant achievement that has happened in the city of Mumbai. So these are the two used cases. Now, if you talk about what automation can bring about, we need to understand that, I spoke about the importance of entering the dialysis data and tracking the quality. Incidentally, the dialysis machines that are available in our country, they are not talking to the Access EMR systems, as a matter of fact, any EMR systems, because the OEMs do not allow that. So we are working on a project wherein we will take a picture of the data which is available in the machine, and through an OCR tool convert that into the software so that the data can be managed, can be entered and tracked. See, it's important for us to understand that the government is spending huge money on dialysis reimbursements, but there has to be an accountability. Someone needs to look at what is the outcome. To have the accountability on the outcome, data is of prime importance, and that is why it becomes so very important to track the dialysis data to see what impact it is actually bringing to the people. And these are the automations we are working on. Thank you.
Truly remarkable. All of your services, all of your contribution towards this niche of healthcare sector is, commendable. And we wish you all the best for changing more and more lives every year. And we hope to see you again on our upcoming conclaves. So please stay tuned.
Thank you so much.
Thank you. Have a nice